Epstein-Barr virus or EBV is a type of herpes virus and among most common human viruses. EBV is spread most commonly over body fluids, especially saliva. The infection due to EBV is most common in childhood, with a second peak during late adolescence. By adulthood, more than 90% of people have antibodies against the virus. EBV is an important agent of infectious mononucleosis, or IM. Infectious mononucleosis tends to infect children in early age in lower socioeconomic areas. In higher socioeconomic situations, EBV is often delayed until adulthood and is more common than lower socioeconomic areas. The incubation period of IM is 4 to 6 weeks, with a prodrome of myalgia, fever, and malaise. After 1 or 2 weeks, other symptoms will appear, such as low or high-grade fever that may last for about 1 month, sore throat, pharyngitis, and lymphadenopathy that usually affects posterior cervical lymph nodes. Another common sign is tonsillar exudate that may have a white, gray, or green appearance. As you can see in the picture, there is obvious bilateral white exudate in both of the tonsils. The disease usually lasts for about 2 to 4 weeks, but fatigue persists for weeks to months. EBV can affect any organ and has been associated with such diverse manifestations as pneumonia, myocarditis, genital ulceration, and pancreatitis. EBV is also associated with a number of acute complications, and almost all of them are self-limited. One of the most common complications is morbilliform rash, which may happen following the administration of ampicillin or penicillin. EBV is linked to a variety of malignancies, such as Burkitt lymphoma, nasopharyngeal and gastric carcinoma, smooth muscle tumors, and Hodgkin's disease. Here are some EBV laboratory findings. The white blood cell is usually elevated 2 or 3 weeks after disease onset with dominancy of lymphocytes. Low-grade neutropenia and thrombocytopenia are common during the first month of the disease. Liver function test is abnormal in more than 90% of patients. The EBV infection is suspected when a patient presents with typical manifestations of EBV. The peripheral blood smear and antibody studies help to confirm the diagnosis. Many other diseases can mimic EBV characteristics, including bacterial pharyngitis, diphtheria, toxoplasmosis, peritonsillar abscess, scarlet fever, and roseola infantum. The main core of treatment in patients with EBV consists of supportive measures with rest and analgesia. Paracetamol and non-steroidal anti-inflammatory drugs are recommended for the treatment of pain, throat pain, and fever. Patients should avoid heavy physical activities in the first month of the disease to prevent risk of splenic rupture. Glucocorticoid therapy is indicated in patients with moderate to severe EBV and those who are at high risk of complications, especially respiratory obstruction or tonsillar hypertrophy. In this case, prednisolone 40 to 60 mg per day is prescribed for 2 to 3 days, with subsequent tapering over 1 to 2 weeks. Antiviral medications such as acyclovir have no any effect on EBV, so they should be avoided in these patients. Now let's see how can we prevent EBV. First of all, we need to know isolation is not necessary in infectious mononucleosis. Frequent hand washing and not sharing eating utensils and drinking glasses may reduce the risk of transmission. Vaccination against EBV reduces the frequency of the disease, but has no any effect on rate of symptomatic infection.